mode.
Good afternoon. My name is Tilghman-Bryant with C-Change, and I will be serving as the moderator for today's webinar entitled Coalitions Kicking Butts, Tobacco Control Policy Approaches. This webinar is brought to you by C-Change and Legacy, endorsed by the Comprehensive Cancer Control National Partnership, and supports the partnership's ongoing work to further the comprehensive cancer control movement in all states, tribes, tribal organizations, Pacific Island jurisdictions, and territories. I would like to extend a special thanks to Legacy and Susan G. Komen for the Cure for their ongoing support of C-Change's work in comprehensive cancer control. This webinar is the second in a series of 3 webinars focusing on cancer risk reduction. Today's webinar will focus on tobacco policy issues, and the third and final webinar in this series will focus on obesity and its correlation to cancer. It is our goal today to empower state-level coalitions to better advocate for solutions to bring about sustainable change in tobacco use, and we will provide you with an overview of best practices in tobacco control presented by Pete Fisher, an overview of the Food and Drug Administration Authority and what it entails presented by Dr. David Abrams, and an overview of emerging products and synopsis of other tactics being employed by the tobacco industry to evade FDA and other regulations, and ideas on what state-level coalitions can do in response, presented by Kristen Terzekian. 2 poll questions will appear at various points during the webinar for participants to answer. We encourage you to participate and contribute responses to the questions posed. Because today's Q&A session will not be a live session, only participants joining via computers will have the ability to type a question they would like to ask the presenters using the questions function on their screen throughout the webinar. These questions will be collected and posed to the presenters during the Q&A session. We will attempt to get as many questions answered as time permits, and the answers to questions that are not addressed today will be available online later. Finally, the link to today's recorded webinar will be available tomorrow on the C-Change website, Facebook, and Twitter. I would like to now introduce today's first presenter, Pete Fisher, Vice President for State Issues at the Campaign for Tobacco-Free Kids. Pete has over 15 years' experience in state and local tobacco control policy work. In his current role, he is responsible for managing the campaign's state-level activities, including its team of regional directors and provision of financial and technical assistance to state and local tobacco control coalitions working on policy issues. Pete has been with the campaign since its inception and serves as a member of the campaign's management team. I will now turn it over to Pete to begin his presentation.
Thank you very much, Tasha, and thanks for inviting me to participate in the webinar, and thanks to everybody who's taking the time to listen in. We can go to the next slide. We'll start right in. I thought we would just start by reviewing the toll that tobacco continues to take on our country. Some of you may be familiar with these numbers. Some of you may not be. And even if you are, I always think it's worth repeating them over and over and over again. Message repetition is the key to a lot of our work. And I think the last bullet here, 90% of lung cancer cases, 1/3 of total cancer deaths, and 1 in 5 deaths from heart disease are particularly relevant for this audience. If we can go to the next slide. Just a few more reminders, and this time of the impact that tobacco continues to take on our young people. We've had some tremendous progress on this front, as we'll see later, but there's still a lot more to be done, as you can see by these numbers, particularly now in the area of smokeless tobacco and some of the cigars and new products that David and Kristen will talk about later. Next slide. So that's sort of a brief illustration of the problem, and one might ask, what is the reason for this problem? And the major reason continues to be, as you can see from this slide, the vast amounts of money that the tobacco companies continue to spend on marketing and promotion. This slide needs to be updated slightly because the trend in their expenditures has continued to come down, but still, as of 2010, they were still spending $8.5 billion a year on marketing and promotion. That's roughly 18 times what the states spend on tobacco prevention and cessation. Note also in the last bar there, the proportion of this expenditure spent on price discounting and couponing and other measures that directly attack our pricing strategies, which are one of the most effective policies we have to reduce tobacco use. So the industry continues to spend at a very high level, and that, of course, is one of the prime reasons for continued relatively high use of tobacco products. We can go to the next slide. I'm sure you're all aware that the industry continues now to claim that it's changed. This is from R.J. Reynolds' website. Ironically, as you see at the bottom there, they claim that they are principled, creative, dynamic, and passionate. They're certainly passionate. They're passionate about selling their existing products and their new products and continuing to addict smokers. Next slide. We happen to know what the truth is. As we've seen from the earlier slides, they're still marketing to kids and targeting young adults. There's a plethora of new and novel products that I think Kristen is going to talk about a little bit later, but they seem to be coming online every day. They're still opposing our policy solutions, even though they themselves acknowledge that they work. They continue to conduct phony image campaigns. They just revived a couple of their tobacco prevention campaigns, know them to be phony and that we know they don't work. And in their expenditures, their marketing expenditures, they continue to take measures to undermine the solution. And if we can go to the next slide. As we've seen, the billions each year to place their products prominently in retail outlets, to continue to promote and advertise tobacco products very heavily, and to price them and to use the couponing and other measures to reduce the price of products and to enhance their appeal to potential users, most importantly, including kids. And the next slide. This is just an illustration from Minnesota of a so-called power wall of tobacco products. And you can see them just lined up there right in front of your face. It's hard to miss. There are measures that states and localities can take to address these, but there are some really messy First Amendment and other issues that come associated with them. So one has to be very careful. And on the next slide. So I've sort of illustrated the problem and the reasons that we continue to have a problem, and now I'd like to focus on the solutions to this problem. And we firmly believe that they are policy-based solutions, that is, public policies, such as higher prices on tobacco products, smoke-free workplaces, etc. And there are a couple of reasons for this. Prevention and cessation programs are very effective, as we will see later, but their effects are enhanced by policy change. Also, particularly these days, in an era of diminished resources, population-based approaches such as a higher tax or a smoke-free workplace law are more cost-effective and can have a bigger impact in a shorter amount of time. Next slide. So these are the tools of tobacco control, some of the major policy areas that we work on, and others, like legacy and cancer, heart, lung, and many other partners. At the state level, excuse me, at the state level, we concentrate on the first three, and I'll be talking about those three policies more comprehensively. We do a little bit of work on cessation coverage, and that's going to be particularly important as the healthcare reform law rolls out over the next couple of years. We also are very heavily involved in the FDA effort, limits on industry behavior, and David Abrams will take you through that shortly. You put all these policies together and others, and what we're aiming at here is to bring about a social and environmental change where tobacco use no longer is acceptable. And next slide. So I mentioned the three policy areas that we focus on at the state level. We refer to this as the tobacco control trifecta, and that includes smoke-free workplace laws to make all indoor workplaces, including restaurants and bars, smoke-free, higher prices for tobacco products, mostly through taxing authority, higher taxes on cigarettes and other tobacco products, and state funding for comprehensive tobacco prevention and cessation programs. So we'll deal briefly with all three of these areas. Next slide, please. Let's take smoke-free laws first. We believe, as does every tobacco control advocate around the country, advocate and organization around the country, that everyone deserves the right to breathe smoke-free air. And a smoke-free law, comprehensive smoke-free law, is the only way to protect everyone from secondhand smoke. It improves, and these laws have been demonstrated to improve the health of workers and patrons at businesses. They do prompt more smokers to try to quit, and they do increase the number of successful quit attempts. These are not arguments that we use very often in policy debates when we're attempting to enact such laws, because it, in fact, gives a little fuel to people who say that we are about social engineering. But the fact is, although we don't talk about it that much, that these laws do contribute to helping people to find ways to quit. And the last point you see here is a point that we have to make over and over and over and over again when policymaking bodies debate these laws. These laws do not hurt businesses. Particularly, they do not hurt restaurants and bars. It's important to keep that in mind. It's been demonstrated over and over and over again wherever these laws have been enacted, statewide or locally. We can go to the next slide. Every smoke-free law is popular. They're popular when we poll before they're enacted during the legislative debates, and if anything, they get more popular after they've been enacted. I think we've certainly polled in every state over the years on all three of these issues, and I can't recall a poll where we've received less than 60% support during a legislative debate from voters across ethnic groups, across ideology, and so on. This is a poll that we took after the New York City law had been enacted back in 2004. It's kind of a little different. The law was under attack from some media outlets and others in New York City. So we took a poll to measure the popularity of the law, and we found not only was it popular in and of itself, but when we stacked it up against such New York City icons as the Yankees and the Knicks and hot dogs and Donald Trump, we found that it was even more popular than those figures. So these laws, particularly when they're enacted, everybody loves them. We can go to the next slide. Tobacco excise taxes, we call these a win-win-win. They're a win for public health, they're a win for state budgets and revenue, and again, they're a win even for politicians, because voters approve of raising cigarette taxes, unlike just about every other tax you could name. And if we could go to the next slide. Scientific data over the years, voluminous amounts of scientific data have documented the impact of higher prices. The estimates are, the well-established estimates are that for every 10% you increase the price of a pack of cigarettes, you get about a 7% decline in youth prevalence, about a 2% decline in adult prevalence, and that results in about a 4% decline in overall consumption. So that the first win is a win for the health of the citizenry of the state where the tax is increased. Next slide. And the second win is for the budgets of the states. Tobacco use does go down when the tax and the price goes up, but every time there's been a cigarette tax increase, there has been an increase in state revenues. The opposition will argue that that's not the case, that that's a false argument. We know for a fact that increasing tobacco taxes always increases state revenues, despite the reduced consumption and some tax avoidance. We don't shy away from the fact that some people will go to the internet or across to another state if they can make it, or to a tribal reservation and try and avoid the cigarette tax. But it doesn't matter. The revenue always goes up. And if we can go to the next slide, this is a demonstration of the impact in one state, in Kansas. Double-barreled tax increase back in the early 2000s, about a 21.5% reduction in the number of packs sold, and a corresponding 142% increase in revenues for the state. That is just reflective of every state in the country. And if we go to the next slide. The third win is a win for politicians, because voters support raising cigarette taxes. And again, this is from the Kansas increase of several years ago. And these numbers are, again, reflective of what we see in just about every state in the country. Support for raising cigarette taxes outpaces any support for raising any other tax. It crosses ideological boundaries. It crosses ethnic boundaries. It crosses income boundaries. It's just a political win for any politician who takes a vote to raise the cigarette tax. Excuse me. Next slide. The third leg of the trifecta is funding for comprehensive tobacco prevention and cessation programs. And again, this is from the Institute of Medicine. There's a convincing and long-standing substantial body of evidence that these programs work based on actual experience on the ground. And if we go to the next slide, you'll see from a study of 4 of the earliest programs that were established in Arizona, California, Massachusetts, and Oregon, those programs, when they were funded and sustained, helped reduce cigarette sales about twice as much as the rest of the country. So these programs, when they are funded, which is a major problem at the moment, and sustained over time, combined with the other 2 legs of the trifecta to sustain the reductions in tobacco use. If we go to the next slide. This is a map of the current status of funding, and you can see it paints a rather bleak picture. There are only 4 states, can't count, 1, 2, 3, 4, 5, that fund even at 50% of the recommended level that CDC recommends each state spend on tobacco prevention. CDC put out a booklet called Best Practices in Tobacco Control back in 1999 and updated it in 2007 that recommends by state the amount of money that state should spend on a tobacco prevention program. So we report on this every year, and as you can see, the vast majority of states are spending at less than even half of what the CDC recommends. And that amount, as we'll see, I think on the next slide, has fluctuated dramatically since fiscal year 1999, reached a high watermark in fiscal year 2002, and again close to that fiscal year 2008, but has been going down precipitously since then due to the ongoing financial crisis that most states have found themselves in the last few years. And if, again, you go back to our early slides, the industry continues to spend upwards of $8 billion on marketing, while across the entire country, less than $500 million is spent on prevention and cessation. And if we go to the next slide, This is another illustration relating to how much money the states take in from tobacco taxes, and from their master settlement agreement revenues, a total of almost $26 billion annually across the states. If every state funded at the CDC recommended level, that would only take about $3.7 billion of that money, so about roughly an eighth of the total amount of money that comes into the states every year. And again, you can see the paltry amount that's actually being spent. This is one of my favorite slides because it really documents the incredible opportunity that the states are missing. Wouldn't even have to spend a lot of their tobacco revenue on prevention and cessation. And if we go to the next slide. We'll wrap up here by sort of looking at the state of play and the other legs of the trifecta. This is the current map of comprehensive smoke-free laws that include restaurants and bars, and you can see the yellow documents those states that have those laws in place. And you can see by the states that don't have them yet in place, we've got some of the toughest states in the country there to still to deal with. So we made a ton of progress on the smoke-free issue, but there's still a lot to do. And if we'll go to the next slide. This represents the increase in the percentage of the population that's covered by laws that prohibit smoking in all restaurants and bars. You can see as of last year we're up to 65%, but again that 35% reside in some of the toughest states politically on this and other tobacco issues. And if we go to the next slide. This is a current map of cigarette tax rates around the country. You can see the highest rate continues to exist in New York at $4.35 a pack. The lowest rate is in Missouri at 17 cents a pack, and we're at a loss as to what to do in Missouri, frankly, on the tax front. The only way you can increase the tax by any significant amount in Missouri is through the ballot process, and it's been tried 3 times in the last 10 or 12 years, and each one of them has failed very narrowly. But you can see Missouri, California, oddly enough, and North Dakota are the states that have yet to pass a cigarette tax increase in this century. But again, if we go to the next slide, we can see that the average state and federal tax has risen quite steadily over the last many years, to the point where if you combine the two, we're at an average of $2.49 a pack. We hope to get, progress has slowed quite precipitously the last couple of years, but we're hoping to get a few big state increases again this year and drive that average per pack tax up a little bit further as well. Now we'll just go through these last few slides quickly. I think we're running out of time here. Just taking a look at the impact of the trifecta. I think this is, we one slide too far ahead here. There we are. You look at what's happened in New York City, where they've had a comprehensive smoke-free law in place. They have a very high tax, and they benefit from the statewide prevention and cessation program, which is not fully funded, but still does a terrific job, has quite a bit of money. You look at the impact in New York City, it's been quite dramatic. When you get all 3 of the legs of the trifecta working together, you can reduce tobacco use dramatically. And these last few slides just indicate the progress we've made in youth smoking. Next slide. And the next one. And in adult smoking, there has been a leveling off the last couple of years, so we still have a lot of work to do despite all this success. And if you go to the last slide, from these smoking declines, these are the numbers that we have currently. As you can see here, almost 3 million fewer current youth smokers, and so on and so forth. I think a key number for policymakers to look at is the last one. Everybody's concerned about healthcare costs. We think the progress that's been made over the last several years has resulted in about $90 billion in lifetime health care savings from smokers, from preventing new smokers. So we have a lot to do. We made a lot of progress. We have a lot to do, and I hope that you all will join us in this fight. And I think I will wrap up there. I'm happy to take any questions after we've all finished. Thank you.
Thank you, Pete, for that informative presentation. We are now going to launch our first poll. You will see a question appear on your screen. I want you to take a minute to select an answer. We'll give everybody about 20 more seconds. Okay, we're going to go ahead and close the poll now. Wow. And it looks like, based on the question, 47% of individuals that are participating in the webinar that are involved in coalitions are working on smoke-free regulation. I want to thank everybody for participating in the poll, and we're going to quickly move on to our next presenter, Dr. David Abrams, Executive Director of the Schroeder Institute for Tobacco Research and Policy Studies at Legacy. Dr. Abrams has published over 250 scholarly articles and is the author of the Tobacco Dependence Treatment Handbook, a guide to best practices, a recipient of a Book of the Year award. Recently, Dr. Abrams is focusing on the role research can play in informing policies for the regulation of tobacco products by the Food and Drug Administration. I will now turn it over to Dr. Abrams, who will provide us with an overview of the FDA authority.
Thank you, everybody, and I'm going to try to make this very short, so forgive me if it's a top-of-the-tree summary of some of the key issues, but I have also provided in my slides some references for more in-depth follow-up, and certainly the Legacy website, as well as Tobacco Free Kids and others, have lots of information on their websites, and we all have resources and stand ready to support the states in their efforts to reduce the death, disease, and dollar costs of tobacco. So if I could have the next slide, please. The details of the Family Tobacco Control Act are now over 3 years old. And of course, I encourage everybody to read this tomb of a document just to be familiar with the specific, at least top-line summary of the essential elements in the Act. And again, there are supportive summaries on the Center for Tobacco Products website at the FDA, as well as on the Legacy website, Tobacco Free Kids, and other websites in the coalition of stakeholders for tobacco control efforts. Next slide, please. In terms of one of the key issues around the FDA, is there's now a very important distinction between the mandate in the Family Act, which states that this must be for the benefits of the population as a whole. And that means, of course, reducing youth uptake and progression, as well as increasing the likelihood that adults will stop smoking. What's important in terms of a take-home message with this new FDA mandate is that this population level criteria is different from the usual government regulatory science criteria, which generally focus on individual safety and efficacy, such as in the CEDAR branch of FDA, the Center for Drugs and Devices, where, for example, there's much more interest in the harm and benefits to the individual as opposed to the population as a whole. And you'll see in a minute why that distinction between population level benefit versus individual level benefit and harm reduction is so important. Next slide, please. In terms of the top-of-the-line summary of the key elements in the Act, I'd just like to thank Matt Myers and the Center for Tobacco Free Kids, who I think have articulated much more effectively than anyone else some of the top-line take-home messages. and some of these slides are borrowed from Matt Myers' presentations over the last 3 years. And while I'm not a lawyer, I think this is a very clear top-of-the-tree summary of the key elements in the Act. The first is that there are now strict requirements to provide information from the industry that increases transparency and allows access to raw data, industry marketing, research, and so on. And I do not think that this option has been as aggressively used as it could be in terms of getting industry disclosure of key information. Secondly, there's restrictions on marketing provided in the Act, especially as it appeals to kids, might mislead adults or deceptively encourage tobacco use. Thirdly, the law strengthens the restrictions on the sales to youth. And fourthly, next slide please, it more accurately informs consumers to improve warning labels, the testing, and product standards to prohibit unsubstantiated health claims. Fifthly, there's the regulation of the actual content of the product, as well as, finally, they articulate some specific balances with the state authority. So those are the top-of-the-line key elements in the Act, and I'm going to drill down a little bit with some specifics that are most relevant to the states. Next slide, please. So some of the things that are really hot button issues at the moment are summarized in a lovely article commentary that Dr. Mitch Zeller published just a few months ago in Tobacco Control, and I encourage people to read this. It's essentially a summary of 3 years after enforcement of the Act. What has the FDA done? Where are the hot button topics, and where could the FDA have its strongest leverage points where we hope in the coming years there will be more aggressive attention to the regulatory authorities that would allow us to reduce the harm to individuals as well as I said, the population as a whole. And some of the key issues are, in fact, the product standards, whereas you know the FDA has received a recommendation to ban menthol flavoring from all cigarettes because the science is strong enough to suggest that it does reduce youth uptake if it were banned, and among some groups might help facilitate cessation of menthol users. And of course it has the authority as well to reduce the nicotine levels in cigarettes to non-zero, and the science for that is currently being developed. There's also important provisions for the introduction of new products, as well as whether a product that is introduced is substantially equivalent to an existing product or not. One of the biggest concerns and issues is around new modified risk products that have claims of reduced harm. And these might include future iterations of aerosolized electronic type cigarettes that are being developed by Philip Morris, for example, as well as other tobacco companies. And this will be discussed in the third presentation in more detail. And fourthly, and somewhat of concern, is that the current rules do not automatically apply to things that are not defined as cigarettes or smokeless tobacco products in the Act. And currently what is not in the Act includes cigars, including flavored little cigars and cigarillos, all e-cigarette products and other reduced harm types of products that contain nicotine derived from tobacco, such as dissolvables. So this has created a gap in the regulatory authority, and at the current time, many of these products are being introduced and sold without any regulatory authority, which really reminds us of the old industry playbook that we know so well. And again, you'll hear more about this from the third presentation. Next slide, please. So ways to inform the FDA and help them to support their regulatory authority include various options for citizens' petitions, docket submissions, testimony, and complaints to the CTP website, which include requests for things like enforcement of sales to minors in retail outlets and so on. And you can see from this list several other opportunities where one can make presentations on scientific issues. And here we give some examples that we have participated in the last 3 years on how we could use the science to leverage the FDA. We have formed at Legacy and with CTFK and other stakeholders a coordinating group to ensure that we can identify hot-button science topics that might warn us, sort of a canary in the mine kind of issue, and strengthen the collaborations we now see that are necessary between federal, state, and local experts, as well as scientists, lawyers, advocates, and other stakeholders. We need to rapidly anticipate industry challenges of FDA regulations, and we also need to look very carefully at new and emerging products. Next slide, please. So just a quick reminder, the youth access restrictions have been reinstated, as you know, and I'll just go to the last bullet here. There is now an option in the FDA to request that those that feel there's a higher ratio of things like high-risk youth with menthol cigarette smoking, one can request assistance from the FDA to deal with these issues, such as underage uptake in those communities. Next slide, please. So in terms of tobacco product standards, the FDA does have the authority to ban menthol in cigarettes, for example, to reduce nicotine levels, to control other substances, but we have to be careful that we focus not only on the individual effects that might reduce harm, but also the population effects. What is important to note is while the FDA is precluded from banning all cigarettes or all smokeless products, in other words, a class of products cannot be banned by the FDA, these limits actually do not apply to the states on a case-by-case basis. Next slide, please. So, for example, in terms of preemption issues, states have quite a lot of broad authority to restrict the time, place, and manner of tobacco smoking. Next slide, please. And so, to be clear, here are things that the states may not do in terms of the requirements that have to do with preemption. And in the next slide, here are some things. The next slide, please, by the federal regulations. So if you could back up one slide, please. So here are some of the preemption-related examples that states are not prevented from doing. And so, again, we'd like to see more of this kind of activity to use the leverage of the FDA and combine it with state-level regulatory authorities. Next slide, please. So I'm just going to very quickly go through the next set of slides in the interests of time. And again, these slides are available, and you can look up the articles in the journals that are cited here. But we have provided a quick summary of the essence of the FDA regulation and how science can be used to advocate for the policy and changes using the new Tobacco Control Act. Next slide, please. For example, we've published research that shows that if we do ban menthol, by the year 2050, we could save over 250,000 to 750,000 lives total, and at least half to a third of those lives saved would be among African Americans, 80% of which smoke mentholated cigarettes. Next slide, please. I think also we need to look at future directions, especially the morphing of the industry and the introduction of this panoply of new potentially reduced harm non-combustible products, which again will be presented in detail in the next presentation. So I won't mention more about that here. If we could just go to the next slide. We also have the capability at Legacy, and we're going to be scaling this up, to monitor in real time point of sale in terms of both price, new products, and enforcement of regulations. Next slide, please. So for example, in Washington, D.C., these red dots represent every grocery store tobacco sales outlet. And we found that just in the D.C. neighborhoods, among low-income communities, there are discount pricing for things like little cigars and cigarillos, as well as lower prices per pack. Next slide, please. And again, as I said, new products really provide a very thorny hot-button issue that I think both states that are test markets for these new products and researchers, as well as advocates and legal entities, need to act together very, very fast to get on top of this panoply of new products coming onto the market. Next slide, please. For example, we've done a survey of the use and perceptions of harm of e-cigarettes, which you can see the publication of for details. Next slide. We've also monitored the industry, and a very big issue is coming up where the industry, particularly Philip Morris International, is building new factories in Europe to market a second-generation aerosol product, we think, that may be better than the e-cigarette at delivering satisfying nicotine to the brain without the combustion and toxic tars that one finds in burning a lit cigarette. So this is a very hot issue that's emerging in the marketplace. Next slide, please. And so we also have to be careful that, for example, Altria submitted this docket submission on modified risk products, and just take a quick note of the preamble run by Altria that essentially warns the FDA and the tobacco control community that if we slow and delay the pre-market approval of modified risk new products, in a sense, we may unintentionally be killing people and preserving the cigarette smoking as the dominant form of tobacco use. So they're essentially saying if we slow down the approval of modified risk products, they're going to use that information against us to say they have reduced harm products and we're stopping them from getting to the marketplace. So I think this is a very troubling development that we need to pay attention to. Next slide, please. So in a sense, I've given you a few key topics and hot button issues that I think states, federal agencies, researchers and advocates and tobacco control people at every level need to really coordinate and come together to both monitor the canary in the mine issues, produce the research that will help the FDA both to preempt the uptake of dangerous or harm-inducing products and to fully use the regulation to reduce the death, disease, and dollar costs of harmful products. Thanks. That's the end of my presentation.
Thank you, Dr. Abrams. We're going to quickly go to our next poll. Again, you're going to see a question appear on your screen. If you can quickly select an answer or answers to the question. We're going to leave it open for a couple seconds. Take people time to respond. Leave it open for one more second. Okay, we're going to close the poll. And it looks like one of the major barriers or challenges that are affecting most of the participants would be lack of financial sources, financial resources. Very interesting. We're going to quickly move to our next and final presenter, Kristen Terzekian from Legacy for Longer, Healthier Lives, who will present on industry tactics. Kristen is the Senior Manager of Training and Technical Assistance at Legacy. One of her interest areas is little cigars and cigarillos, and other emerging tobacco products. Prior to joining Legacy, Kristen worked at the National Campaign to Prevent Teen and Unplanned Pregnancy and the Association of State and Territorial Health Officials. I will now turn it over to Kristen.
Well, thank you so much to Sea Change for inviting me to speak on this important topic. As Tasha mentioned, I'm going to cover an array of emerging tobacco products, highlight some state and community efforts. In looking at the time, I'm going to skip over a couple of slides and going to try to talk as fast as possible, so my apologies. Next slide, please. You know, as Dr. Abrams was presenting in the previous presentation, the tobacco product landscape has dramatically changed over the past few years. These are not your typical cigarettes. They've been introduced by the tobacco industry in many cases as replacement type products, given the decreases in smoking rates and more smoke-free public places that Pete talked about in the first presentation. And some of these products are not being currently regulated under the FDA. Next slide. So first we'll start off with little cigars and cigarillos. These are not new products. They're sold in all states and communities, but we include them with the emerging products because we're seeing some disturbing trends in cigar prevalence. So let's start off with the definition of a cigar. This comes from the U.S. tax code, and it defines them by weight and wrapper. I'm sorry if this is boring. As you can see in the photos, the little cigars and cigarettes look quite similar. They're about the same size, weighing both less than 3 pounds per thousand. But the main difference is that a cigarette is wrapped in white paper, whereas a little cigar is wrapped in brown paper that contains some tobacco leaf. Cigarillos are medium-sized cigar. There's actually no federal definition, so they get lumped into the tax category with large cigars, which are the typical stogie-type cigars, and those weigh more than 3 pounds per thousand. Terminology is very important, especially when it comes to measuring prevalence and for tax purposes, which I'm going to talk about in a minute. Next slide, please. So little cigars are not regulated by the FDA, and as such, they come available in a variety of flavors: vanilla, grape, chocolate, menthol. And just like cigarettes, they're sold in packs of 20. However, they can be sold individually. So if you take a look at the Primetime Little Cigar on the right, you can see it's sold in a plastic tube, and it looks just like a Burt's Bees lip balm. So today, there are actually few products marketed and sold as little cigars that meet the federal tax definition. Most little cigars manufacturers have increased their product size, so they technically meet the definition of a large cigar and they get a better tax treatment. At the federal level, little cigars are taxed at the same rate as a cigarette, $1.01, and large cigars are at 40 cents. So if you look at the Cheyenne photo in the middle of the slide, the product, the candy flavors, the packaging remains almost the same, except the cigar on the right weighs slightly more, so again, it's categorized as a large cigar for tax purposes. And there is currently a bill in Congress that would bring tax parity to these products. Next slide, please. On this slide, you can see the most popular cigarillo brands. Again, these aren't regulated by FDA. They come in flavors. They're often sold in packs of 5 or 2, but it's legal in most communities to sell them individually. A single cigarillo is pretty cheap. It costs less than $1. So you can imagine you have these cheap flavored products. They may be more palatable to a teen. And one of the most popular brands, Black & Mild, is owned by Philip Morris. Next slide. So why are we so concerned about these products? I mean, first of all, oftentimes people think cigars are healthier alternatives to cigarettes. This couldn't be farther from the truth. They're just as harmful. I mean, also in terms of data collection, there are no federal surveys that provide data stratified by the 3 main cigar products. So they ask about cigars, including little cigars and cigarillos. So some research finds that tobacco users, especially teens, if you are asked, do you smoke a cigar, the answer is no. If you ask, do you smoke a Swisher Sweet, do you use Black & Milds, all of a sudden the answer becomes yes, and it's much more accurate. So we think that the little bit of data that we do have now is underreported. And again, in terms of FDA regulation, the FDA has indicated it will release a deeming regulation for other tobacco products this April. We don't know what the rule will look like, but there will be an open comment period where agencies, organizations, community organizations can submit public comment, and we encourage you to do so. Next slide. When you take a look at state-level data, I mean, it's pretty interesting. We're seeing this growing trend, especially among teens, where the cigar use is catching up to cigarettes. And so I highly encourage you to look at your state's Youth Tobacco Survey or the Youth Risk Behavior Survey. And again, this comes from the most recent YRBS. We see that cigar use has actually become more prevalent than cigarettes among Black high school students overall, and it's also surpassed cigarette use in at least 5 states. Next slide, please. So let's switch gears to smokeless products, and we'll start off with snus. This is a spitless product originally from Sweden. It's much more discreet and neater than traditional moist snuff. And American companies like Camel and Marlboro are now producing and selling snus nationally. And it's important to note that the snus manufactured in the U.S. is not the same as Sweden's, and we don't know enough about the health effects. The rates of smokeless tobacco are highest among young adults 18 to 25 years old compared to any other age group. And when you look particularly at the rates among high school boys, the rate is over 20% in 11 states, which is alarming. One of the many concerns with this product, of all smokeless tobacco products, and other tobacco products for that matter, is dual use with cigarettes. So almost 60% of smokeless tobacco users also smoke cigarettes, and this means that they are being exposed to even more harmful toxins and chemicals, which may increase the risk of disease, and it also keeps people addicted to nicotine, making it harder to quit. Now, the FDA does have authority to regulate smokeless tobacco, including snus, so you can see the larger warning labels that are on the packaging and ads in the next slide. And if you switch to the next slide, I'm actually going to skip over this for the sake of time, but I just wanted to mention that according to the FTC, the Federal Trade Commission, the industry spent $444 million marketing smokeless tobacco products in 2010 alone. So let's move on to dissolvable tobacco. This is finely milled tobacco that dissolves in the mouth. It doesn't require spitting, and we have very little information on prevalence or the health effects. Dissolvable is a very diverse category of products, especially when it comes to FDA regulation. Some contain tobacco, so then they meet the definition of smokeless tobacco products, which means they are regulated by FDA. So these photos are sort of an evolution of dissolvable products. You have Stonewall and Arriva tobacco orbs left. Those resemble mints. They were test marketed in early 2000s, and Arriva is available nationally. Then Camel entered the market with sticks, orbs, and strips. These were introduced in 2009 in limited markets: Indianapolis, Columbus, Ohio, Portland, Oregon, and then Colorado and North Carolina. And most recently, Marlboro and Skoal have got in on the game, and they test marketed sticks in Kansas last spring. Generally, these dissolvable products contain 1.5 to 4 milligrams of nicotine per unit, and on average, a person absorbs 1 to 2 milligrams of nicotine from a cigarette. And I'm going to skip the next slide, and we'll go to slide 72. So over the summer, Altria announced it will be selling Verve, which Dr. Abrams mentioned. This is marketed as a tobacco-free nicotine lozenge or disc. So the nicotine is extracted from the tobacco. The disc releases nicotine as a user chews on it, and then it's thrown away after each use. And each disc contains approximately 1.5 milligrams of nicotine. R.J. Reynolds has test marketed 2 similar products, Philo and Flex, in North Carolina and Virginia. Now, because these products don't contain tobacco, they don't meet the definition of smokeless tobacco for FDA, so they're currently not regulated. Again, however, when FDA proposes the steaming regulation over other tobacco products, we'll see what that looks like. But until then, they remain unregulated. If we go to the next slide. So water pipes or hookah, these have been used for centuries to smoke tobacco. In Arab American communities, the hookah pipe is known as the argyle. It's a cultural fixture. It's a component of family gatherings and signifies hospitality. This is becoming much more popular among college students in the military. And contrary to popular belief, the smoke that emerges from the water pipe is not filtered. One study concluded that a 45-minute session, a hookah smoking session, has the same health damages as smoking 9 cigarettes. And a single water pipe use episode can yield slightly more nicotine than a single cigarette and about 36 times the amount of tar and 8 times the amount of carbon monoxide. Next slide, please. Again, it's popular among college students, and we know that about 2/3 of states have hookah bars and cafes. And again, most of these bars are located near college campuses. Some even cater to youth under 21 as long as no alcohol is served. And hookah tobacco is taxed as pipe tobacco, which is much less when compared to cigarette tobacco. And again, currently the FDA does not regulate hookah. If you go to the next slide. Thank you. Dr. Abrams talked a little bit about e-cigarettes, and just for the sake of time, I'm more or less going to skip this slide, but only to say traditionally these products were being manufactured by Chinese companies, and now the American companies are getting into the market. So you have Blue Cigs, which is now owned by Lorillard. You could see the ad on the right. They recently launched a national media campaign with TV commercials and print ads featuring the actor Stephen Dorff. And Swisher Sweets recently introduced its own line of disposable e-cigs and cigars as well. If you go to the next slide. And actually, just for the sake of time, we'll skip over this, but this is a pretty interesting study from Legacy looking at dual users of cigarettes with other tobacco products. And again, the health effects, it's just so much more when these young people and adults, they're using multiple tobacco products. They're getting exposed to even more toxins and chemicals, and it's just going to make it even harder to quit. Next slide, please. So here are some examples of states and communities who have made other tobacco products a priority. This slide is a sample of policy change with respect to emerging products. It's by no means an exhaustive list. And please note that Legacy cannot lobby. We were not involved in any of these efforts, and I'm simply presenting this for informational purposes. So you could see New York City and Providence, Rhode Island have banned the sale of most flavored tobacco products. That includes cigars, smokeless, and pipe tobacco, and both of these laws were upheld in court. Other communities are regulating the packaging size for cigarillos by banning single sales, which appeal to youth. And as you can see in 2 communities in Maryland, these regulations are being upheld in court. If you go to the next slide, please. Other localities have addressed e-cigs and hookah use. You can see the Boston Health Commission is requiring that e-cigarettes be placed behind the store counter like tobacco products, and they've also included it in their citywide smoke-free air law. Next slide, please. And I'll just close with a sampling of some state initiatives. Maryland has a really interesting public education campaign. They found that the cigar use was increasing among high school students, while cigarette use had dramatically plummeted. So they responded by launching a media campaign to educate parents and community stakeholders about the dangers associated with smoking flavored cigars. The campaign was supported with CPPW funds, and you could see the ad in the upper right-hand corner. During the focus group testing, one young person commented that you can buy cigarillos from the back of an ice cream truck, which is alarming and a really powerful message to give to parents. So the final ad features a cigar on the top of an ice cream truck, and the tagline is, "No matter how they sugarcoat it, cigars kill." They had a print, billboard, transit, radio ads that ran last winter. They also have an educational website and an online toolkit. And meanwhile, public health advocates supported a bill to increase the tax on these products to bring parity with cigarettes. Massachusetts has also been doing interesting work on emerging tobacco products. Their community programs have conducted surveys on the availability, advertising, and packaging of cigarillos. They're educating residents and stakeholders, again, PTAs, school boards, about these harmful products. And their teams have really gotten involved in terms of advocacy with their local legislators and decision makers, and they're finding supporters for tobacco prevention and control where they really haven't had them before. And one of the most powerful things you could do is a show and tell. And you just go to your local convenience store, buy a lot of these products, and show it to decision makers, show it to parents, and to say, you know, this is what's on the horizon for our teens. And there are other communities, Florida and Wisconsin, that have gotten involved too. But for the sake of time, I'm going to skip that and just close with the next slide, ways to get involved. Again, education, involve youth. You can add product and brand-specific questions for the emerging tobacco products to state and local surveys as well. So I will close there, and I apologize for going over time and talking a mile a minute.
Thank you, Kristen. We're going to quickly, we have received a couple of questions. We're going to quickly pose a couple of questions to the presenters. The first one is to Pete Fisher. What is the source that smoke-free policies are the most cost-effective and have the biggest impact? Is this based on a specific study?
It refers to policy change in general, not just the smoke-free laws. Yeah, there have been studies done that show the impact, for example, of a cigarette tax increase. I don't have the slides in front of me now, but I'm talking from memory here. The impact of a cigarette tax in a state like, say, Mississippi on the population as a whole, you know, the cost would be the lobbying campaign to pass the cigarette tax, whereas the cost of doing, say, you know, an individual cessation program would be much more. Now, you know, we're certainly not saying don't do the cessation programs, but our point is that policy change avenue is a little more cost-effective, and when you combine all three elements together, it becomes even more effective.
Thank you, Pete. Our next question is to Dr. Abrams. Wouldn't banning menthol be a harm reduction strategy?
Yes, I believe it would, and there is a comprehensive review and recommendations that were mandated in the Act to the Tobacco Advisory Committee called TPSAC, T-P-S-A-C, which are available on the Center for Tobacco Product website at the FDA. And essentially the key elements were that they recommended that the scientific evidence is sufficient to support banning menthol because it would in fact reduce youth uptake based on the scientific evidence, and that the evidence was sufficiently strong among minorities that it might improve cessation in adults. And there's some evidence, for example, that if adults were forced to not use menthol, they might consider quitting rather than switching to a non-mentholated product, for example. And so it would be a harm reduction strategy in the sense that several people have said menthol, because it anesthetizes and makes the taste of the harsh burnt tobacco more pleasant, essentially helps kids as a starter product to adopt menthol, and then they switch later to non-mentholated products. So in that sense, the menthol flavor, quote, helps the poison go down more easily. Again, like a sugar-coated pill kind of thing. So I think it would be a harm-reducing strategy overall.
Thank you, Dr. Abrams. The next question is for Pete. Do you have resources to suggest on the narrow issue fiscal impact on casinos when smoke-free legislation is passed? Fighting this in Iowa, where someone is fighting this in Iowa where casinos are exempt.
I think Americans for Non-Smokers' Rights would probably be your best source for that information. I'm not aware off the top of my head. There may have been a couple of studies that look at casinos. There's been a lot that look at bars. But A&R would be your best source for that, I think.
Okay. Thank you, Pete. Again, I just want to thank Pete Fisher, Dr. Abrams, and Kristen for presenting such valuable information, as well as to all the participants who took the time to join us, respond to the polls, and ask thoughtful questions. Immediately following this webinar, you will receive an email with the link to the evaluation for this webinar. Please take a few minutes to complete the evaluation, as your feedback will be used to help us tailor the content for the next webinar. Lastly, as a reminder, the link to the recording of this webinar can be accessed via our Facebook page and Twitter handle, which are both listed on your screen starting tomorrow morning. It will also be posted on the C-Change website along with the slides and the responses to questions not answered during the Q&A session within the next 48 hours. This concludes today's webinar. Thank you to all again for participating, and have a wonderful day.
Thank you.